Hello, everybody. Welcome back to the Doc Talk podcast. I'm Dr. Shazma Mithani.
And I'm Dr. Sheila Wijayasinghe.
A special thank you to our episode sponsor today, Figs. So obviously in our line of work, you kind of live in your scrubs. And if you follow us on Instagram, you probably already know this by now. We are obsessed with Figs. They're super comfortable, breathable, durable, and they actually fit well, which is really a high upgrade from the horrible itchy scrubs that were status quo for so long in the hospital. They're just super cute and stylish, and you really just feel good wearing them, you know?
Yeah, like you said, Shaz, we're obsessed. But you know what we love most about Figs? They just get what it's like to work in this field. It's not just that they know what we need, like 7 pockets to carry all our stuff around on shift, but they've also built this incredibly supportive community of people who want to have important discussions and make real connections with other people who work in healthcare. I've been to a couple of events they've done, and it's so refreshing for a brand to show up in such a real way. And you guys, if you're not following them on social media, the memes are amazing. If you work in healthcare or know someone who does, Figs is it. And right now, if you go to wearfigs.com and use code FIGSCA, FIGSCA, you can get 20% off your first order. That's wearfigs.com, code FIGSCA, FIGSCA.
So as we fully move into cold and flu season, we're seeing so many patients come in with cough and breathing issues. And we had the perfect listener question to share, as we often hear this question both in the ER and in clinic as well.
Hi, Dr. Sheila and Dr. Shazma. I've had a cough now for 2 weeks. My friend has the same thing. She got antibiotics and felt better. Like, my family doctor told me antibiotics aren't needed. Why won't they give me antibiotics if they'll help me feel better faster?
I mean, Chaz, I feel like that question sums up respiratory season in Canada, like cold and flu season in Canada completely. I have patients asking me every day, when is it time for the antibiotics? Dr. Sheila, why can't you give me antibiotics? Like, it's in clinic, it's in the emerge, it's everywhere.
I have to say that is a question that I hear in the ER as well. There are often people coming in, coughing, kind of sick of coughing for so long, feeling short of breath, just wanting to feel better again. And they come in asking for antibiotics, expecting that that's going to help, which is exactly why we had this listener question and exactly why we wanted to have this conversation today, because we want to share with you when antibiotics are needed, if they're not needed, and what you can do at home to actually make you feel better.
So let's start with, do you actually need antibiotics? And we decided, because all of you are used to hearing our voices, but we thought, let's hear a non-doctor take on, do I need antibiotics to start? So we actually invited our awesome producer, Drew. Hey, Drew.
Hi.
Hey, Drew. What are your take? Like, what's your take on antibiotics? Because I think we get a lot of questions asking for antibiotics, but what's your take as a patient?
For sure. I really don't want to take antibiotics ever, because I can really feel that they are kind of a nuclear option in my body. And beyond like getting rid of the bad bacteria, I can feel that like my gut bacteria gets messed up, and I just don't feel very good for a while after taking them. So that's my take.
Thank you for that take.
I love hearing that perspective.
I love hearing it too. Yeah. And, I think the bottom line of this, and thank you, Drew, for chiming in there, most coughs do not need antibiotics. And studies show that the vast majority of upper respiratory tract infections are viral. So they're not caused by bacteria, which is what we actually use antibiotics for. They're viral, and they're something called self-limiting, meaning that they just take care of themselves over time without really needing an intervention like an antibiotic. So antibiotics also don't make a difference in how long the cough lasts.
Yeah, and I think that's a really important point, because when I have people coming into the ER asking me for antibiotics, or specifically asking if antibiotics were needed, I think the expectation is that they want their symptoms to go away.
Mm-hmm.
And as you said, most causes of cough were actually viruses, not bacteria, and antibiotics are for bacteria, not for viruses. Even then, there was actually one large study in the US that showed that even when bacteria were detected, antibiotics actually did not reduce the duration or the severity of the illness. And so, while every case, of course, is unique, and we in medicine as physicians, like, take every case on a kind of on a one-to-one case-by-case basis to decide the risk and benefit of using antibiotics and whether it's warranted, most coughs, like 8 or 9 out of 10 coughs, are viral, not bacterial, and do not need antibiotics, like you said.
And it goes back to what you said, actually, what Drew shared around that they can cause quite a bit of side effects as well. They can cause diarrhea. allergic reactions, and it also, very importantly, can contribute to something called resistance, which makes it even harder later on to potentially treat a serious infection down the road when you really do need antibiotics.
Yeah, I mean, we've heard a lot of things in the news about these like superbugs, right? I'm sure that all of our listeners have heard of these before. And a superbug is essentially a bacteria that would normally respond to antibiotics, but over time, because of the overuse of antibiotics, has become more and more resistant. So developed some things, like evolved over time to be able to not respond in a negative way to these antibiotics the way that we would expect them to. And so the more and more we use antibiotics, the more and more antibiotics that these bacteria can become resistant to. And then if you do get these bacteria, they can be very, very challenging to treat and even potentially become life-threatening.
It's also it's not just for upper respiratory tract infections that we are noticing this resistant pattern happening. We should be doing another episode on STIs because we are seeing multi-drug resistant things like gonorrhea and otherwise. And those are another area that why it's important to have something called stewardship over when we are actually prescribing antibiotics to make sure that we are doing so in the appropriate setting to keep you safe now, but also in the future.
Absolutely. And, we talked about how 8 or 9 out of 10 causes of cough are viral, don't need antibiotics. So that means that there are, like a small percentage of cases that do need antibiotics. So why don't we talk about when we should actually consider them? And the main example that comes to mind with coughs in particular is when somebody has pneumonia. And so people who have pneumonia, those are typically bacterial infections, and they would typically warrant antibiotics, or patients who have chronic lung conditions like COPD or moderate to severe asthma. These are situations where bacteria can actually cause a flare-up and may need to be treated with antibiotics.
Yeah, exactly. So for my patients who have COPD or asthma, I'm always asking them when you are getting sick and it's not really clearing very quickly because you may have a prolonged infection due to those conditions, we do want to see you to make sure that we are treating appropriately, and antibiotics are part of that treatment often. It's also important for patients who may be immunocompromised. And so people whose immune systems are not functioning in the ways due to medications that they may be taking or medical conditions that they may have. So for those individuals also, we tend to sort of review things a little bit more closely to see, do antibiotics play a role in this situation? But again, for the average healthy adult or child with a seasonal viral cough, antibiotics will not speed up your recovery.
I think that's really important. And I feel like I hope this doesn't get redundant because this is something that we're going to try to drive the point home of over the course of this episode, because we, like Drew said, we don't want you to unnecessarily have antibiotics and mess up all of the good bacteria that live in your body, right? We have a lot of good bacteria that live on our skin, in our GI tract, on other parts of our body that help kind of keep this balance and help keep our bodies functioning normally. And so taking antibiotics is also not without risk, and important to kind of use them judiciously. So Sheila, when you see a patient that comes in with a cough in your clinic, because I often have people come to Emerge with this, when would you tell them to go and see a doctor, to go either to come and see you, or if you see them in clinic, when to come to the ER?
Yeah, great question. I'm seeing my patients, and sometimes they'll come in after a day or two of cough or even a week of cough, but otherwise they're generally quite well. It's just this nagging cough. And totally understand, like you said up front, Shaz, it is a pain to have a cough that's keeping you up at night. You're tired. You just want to get back to feeling normal. But really what I suggest to patients, if I see them first, I said, listen, if you have a fever that's lasting a few days, like 3 or 4 days, or your fever goes away and it comes back again, that's a condition called double worsening, potentially where you actually do seem to recover and then things get worse again. I want to see you just to make sure that I'm not missing something and maybe there is a role for antibiotics. If you are coughing up phlegm that is worsening specifically, especially if it's like blood tinged in any way, that's also something really important for us to see you for and do a full exam again. If you're having any shortness of breath or chest pain with this cough, also important to get checked out. And anybody where your breathing is getting worse, especially if it's somebody with asthma or COPD. And a good hint for that is, are you using your puffers more than you previously were using? And so if you usually would use your Ventolin or your blue puffer, your salbutamol puffer twice a week, but you've gone up to 6 to 8 times a week, I need to know that, because that's telling me that we're not controlling that asthma very well. And you may need a little bit of assistance in other ways, whether we optimize your puffers or we consider an antibiotic in that situation, or even in some cases, as prednisone, which is one of the steroids that we use in those conditions just to help you breathe a bit easier.
Yeah, and I think that's really important because those are all the same discharge instructions that I give patients with non-concerning coughs that come in concerned, but I'm reassured by, what they're presenting, what their vital signs look like, that sort of thing. And so those are the same discharge instructions that I give patients with cough in terms of the things to look out for. The other thing to keep in mind, if in general, these coughs are just going to slowly improve over time, but the cough can linger. So one thing that I always do in terms of teaching with my patients at discharge, after the acute viral illness is gone, so after like the few days of fever, the sore throat, the runny nose, the congestion, all the like yucky feeling, that cough can linger for up to 6 weeks after that acute infection has gone. And in fact, a third of adults still have a cough even 3 weeks after the viral infection is gone. So this is an important thing just to kind of understand what to expect in terms of the course of illness. And patience is a really, really big part of treatment for these viral illnesses and that lingering cough.
And that's a super frustrating piece because you are generally feeling better at that point, but you still have a nagging cough. And that's understandable, again, why people will come in because maybe it's keeping you up or otherwise. Certainly always seek out support if you are losing sleep or it's affecting your function. But again, it goes back to that point that we're kind of hammering home today, that antibiotics are not going to shorten that duration of that cough. It's inflammation that's happening in your lungs. So let's talk about what actually does help, because feeling that misery for weeks is really rough, having gone through that myself as I lose my voice right now. So tell us, Shaz, what do you tell people? Like you have like discharge support. You do a lot of education for your patients. And I appreciate that so much because I know Emerge is such a busy space that you take the time to educate your patients before they leave around what can you do at home to deal with those nagging symptoms.
Yeah, I mean, a lot of what I do, like you mentioned, is education, especially in the pediatric space, about educating parents on what to expect and, when to come in, when to kind of manage things at home. The one big piece that I often tell adults and parents of kids is hydration and rest. I mean, as adults ourselves, we are always, wanting to recover as quickly as possible, get up, go around, I can totally go for a workout today, or I can totally, take this Zoom meeting instead of getting rest. So hydration and rest are actually a very important component of not only just recovering the rest of your body, but also helping with the symptoms. And so fluids are really your best friend here. Warm fluids in particular can really help soothe the cough, soothe the throat. So things like soups or broth, even hot water with lemon is fine, with lemon and honey is fine. And so staying hydrated actually helps keep the mucus thin and easier to clear when you kind of feel it stuck in your throat. And of course, like I mentioned, rest. Your body needs time to recover, to heal, for your immune system to, help fight that viral infection. So don't feel guilty about needing to nap, because that is actually what your body is likely asking for in that moment. And things like hydration and rest, although they're not, the classic medication or prescription, they are healing and are the medicine that your body needs in that moment.
Yeah, rest is so important. And I'm guilty of not drinking enough water because we're running around constantly. And when I start to feel a bit of a tickle, that's when my hydration levels go up, because I know how important that is. So that's a great point. It's also really important, Shaz, and you must educate around this as well, as around avoiding the things that might add to the irritation that you're experiencing. So things like smoking or vaping or being around secondhand smoke, if you can help that. Or even fragrances can really irritate when your body's already feeling sensitive to cough triggers. You might want to just make sure that you're avoiding those other things. And this is sometimes an opportunity for my patients who may smoke to actually consider cutting back a little bit. And I've seen many of my patients who have a long-term history of smoking, when they start to develop frequent infections or otherwise, they start to notice the association between smoking and the infections being so long that they actually decrease how much they're smoking and they notice an improvement.
That's such an important one to mention as well. Another thing that I often mention to my patients is humidifiers. So this is a non-prescription type intervention that can really help symptoms. And so what I usually tell patients or parents is to set up a little bedside table, right by the head of the bed, and put the humidifier right there so that humidified air around where you're breathing is the closest to your head and neck where you're taking in air. And so that can actually make a big difference for symptoms, including your nasal congestion, your cough, your sore throat. And especially, I live in Edmonton, so it's certainly drier here than it is where you are in Toronto. And the winters can get really, really dry. And at nighttime in particular, I can feel it every morning when I wake up. And so as soon as I start feeling that, even when I'm not sick, that humidifier comes right by my nightstand.
Yeah, it's a good reminder to check your humidity in your home as well. You can always change that. Humidifiers can be really expensive though. So one of the tricks that I tell my patients is they can fill a bowl of water and keep that sort of similarly at the head of the bed on a table, just so it evaporates off and adds a little bit of humidity to the air. It's not the same as a humidifier, but it is an option that can be helpful as well. Hopping in like a steamy shower as well can be helpful just because that warm, moist air helps to open up the airways, loosen the mucus. And then we talked about this before around how do we manage like the back to school germs. Nasal saline sprays or gentle rinses of the nose, they can help reduce something called postnasal drip, where you get the mucus falling down your nasal passages into your throat, causing that irritation and cough. Very, very common after having an infection, like a viral cough, that you get that drippy sensation in the back of your throat. Doing the nasal saline sprays can be very helpful for that. I get a lot of comments whenever I post about nasal saline sprays by parents who say this is impossible for me to do for my kids. What I do with my kids is like teach them how they can do it themselves. There's different misting formulations that you can use. Giving them a chance to kind of take control of the situation helps quite a bit. And then I also explain to them why are we doing it, because it helps them with their symptoms. And often when I explain it to kids and I explain it in my practice, the kids are like, okay, I just want to feel better too. Right. So they may be a little bit more open to it, but it is not always the easiest thing to get saline rinses into kids' noses.
Yeah, and I think that I love that in terms of just empowering your child to be a part of their treatment and the solution for helping them feel better. I think that's a really great way to approach it. Now, I often get asked about cough medicine. I'm sure you do as well, Sheila. And really, I usually don't recommend them. I recommend something a lot more simpler, which is honey. So as long as the person is over the age of 1, because under the age of 1, there is a small risk of botulism, so we don't recommend honey. Honey, so just taking a teaspoon of honey is very, very effective for throat irritation and also for cough. It has very good evidence that it can reduce the cough frequency and is actually been shown to be superior or better than over-the-counter cough medications, especially in the pediatric population.
Yeah, I love a warm tea with like a little bit of honey or lemon. And I also lozenges just to help soothe the throat. Really helpful whenever I'm feeling a bit of a tickle too.
Mm-hmm. And, a reminder that Health Canada actually does not recommend cough and cold medicines, including like cough suppressants for children under 6. And the reason for that is that they actually have really no benefit and they have been shown to cause potential harm with side effects. And again, these really just don't work in that age group. So it's important to stick to all the supportive measures that we've just talked about, like humidification, fluids, honey for anyone over the age of 1-year-old, and then those saline rinses that Sheila, you just talked about as well.
And all these things apply to adults as well. But also for adults as well, we know that there's limited evidence for the over-the-counter cough suppressants, unfortunately. They offer some comfort. They probably make you a bit drowsy, which helps you sleep a little bit better. So they're okay to use, but just be wary that they may not take away the cough, but they can give a bit of comfort. And always check to make sure that they don't interfere with your other medications. Specifically, there's an ingredient called pseudoephedrine, which helps to sort of decrease some of the inflammatory changes that happen in the lungs. But they can interfere with heart medication and they can increase your heart rate. So you just want to be careful of that if you have a heart condition.
Yeah, I think that's important to mention. You can talk to either your doctor or your pharmacist about that. The other thing that I think that we should talk about, you touched on it a little bit, is patients who have underlying conditions that can cause wheezing. So things like asthma, someone who maybe doesn't have a diagnosis of asthma but is prone to wheezing, or COPD. So if you do have wheezing when you have a cough or a cold, you feel kind of this tightness in your chest, especially if you have those conditions that I just mentioned, it's really important to make sure that your inhalers are current, that you're using your inhalers properly, that you have the correct spacer technique. If this is something that your family doctor has not talked to you about, pharmacists can actually help do this teaching as well. Because a lot of times, I'm sure you see this as well, when I see patients come in using their puffer, they're often not using it correctly, which means that medication that is needed to help with the wheezing and the tightness is not being effectively delivered down into the lungs.
100%. And that's really important. And it's actually very difficult sometimes to know if your puffer has medicine in it. And so we sort of like shake it, we feel for weight, but that's not always very accurate. So always check in with your pharmacist. They can really help you out. Whenever I write a prescription for a puffer, I'm actually always saying to the pharmacist, please do puffer teaching with patient, especially if it's their first time using it. There's something called a spacer that you mentioned, Shaz, which is really great. I actually use a spacer because I find it hard to use a puffer. So
like
I didn't
coordinate, right?
To coordinate, yeah. So I use a spacer with my kids, but it's interesting because in Edmonton, I didn't have any breathing issues, but Toronto, because Toronto air is different. And the more pollution, I'm more sensitive here. So when I go for a run, I use my puffer, but I use a spacer because I have a hard time getting it in properly. So there's no shame in using a spacer because this is how you might be able to actually get your medication in properly. And getting that proper technique in is really important. If you don't normally use inhalers, but you are feeling wheezy or short of breath, this is where it's really important, again, to see us, because sometimes even using a temporary puffer or a short course of steroids can help calm that airway inflammation and help you get through that illness.
And, so my perspective as an ER doctor is always to think about when you should see a doctor, even if you're someone that uses puffers normally. And so if your puffers are not working, that is a reason to start to think about seeing your doctor, especially if you're in a situation where the wheezing is actually getting worse despite using your puffers and you're starting to have trouble breathe. Like that one warrants an ER visit, not just a visit to your family doctor.
Let's briefly touch upon something that I deal with a lot in my practice. I'm sure you see this as well, Shaz, but something called post-viral or post-nasal drip. And so post-viral coughs are ones that last a little bit longer than that 3-week cough that you mentioned earlier. It can last about 4 to 6 to 8 weeks sometimes. And it's not due to infection, it's due to inflammation.
I think that's really important because that is a reason that people often come to me and you, I'm sure as well, to ask for antibiotics, because it's the duration of the cough that's making them concerned. And so this is often a common reason for that prolonged duration. And like you mentioned, postnasal drip is another common one as well. And typically what happens is when, the nose is connected to the back of the throat. And so that mucus starts dripping down the back instead of coming out the front. And especially at nighttime, what I often say to patients is you can imagine when you're laying down, gravity is pulling things behind. And it's starting to drip down your throat. You can often even feel it. It causes that like itchy sensation, that urge to cough in the back of your throat. That's probably a postnasal drip that you're experiencing. And it does often get worse at nighttime. And so things like saline rinses, antihistamines, if there's an allergic component to it, or if those things don't work, you can talk to your doctor about using a nasal steroid spray, can really make a difference in the postnasal drip causing that cough.
I love my nasal steroid sprays. They make a huge difference.
It's like during allergy season,
during
right?
allergy season. So
yes.
especially if people have a history of allergies. So I noticed that in my practice, like my patients who have known allergies, when they get a cold, sometimes they do get a little bit more of those postnasal drip symptoms. And we get into that cycle again of like, let's use a little bit of that short-term nasal steroid spray. It helps them clear things up very nicely.
And we always like to kind of approach things in a stepwise fashion, right?
Totally.
So like like we talked about, so trying like the saline spray first, trying some antihistamines if there is an allergic component, and then if that's not working, then talking to your doctor about the steroid spray.
Yeah, so let's chat a little bit, because we chat a little bit like, when do you see your doctor or your healthcare provider if things are getting worse, the fever and shortness of breath. But also it's important to consider getting reassessed as if your cough is lasting longer than 6 to 8 weeks, you have new symptoms that appear like chest pain or weight loss, or you're coughing up blood. Those are all reasons to get reassessed. I also always want to emphasize as well, anybody who has a risk factor for something more serious, so if you have heart disease, if you have an underlying lung condition like asthma or COPD, or you have a smoking history, it's very important to get checked out, especially if these symptoms are persistent and not getting better. I have diagnosed, in some of my patients, I've diagnosed lung cancer, and that's not to scare anybody, but they had risk factors and they had this persistently long cough, and that's something that we always want to just sort of check to make sure, and always good to get checked out earlier than later in those situations.
Absolutely. I think that's a really important piece to mention, because you may not have any of those so-called red flags that we talked about to like see an ER doctor right away, but it is important to think about when to get reassessed, like you said. Otherwise, the name of the games is time, which is often, that's often the trickiest part, right? To just have the patients and know and trust that cough will eventually go away. Drinking lots of fluids and supporting your body with what it needs while it's healing.
And we wanted to just briefly mention, because we would be missing one area of cough that people come in for and don't realize, but it's a little teaser for a future episode, that there are other reasons why people have a persistent cough. And specifically, that's looking at things like acid reflux, allergies, or even certain blood pressure medications, because not every cough is an infection story. So stay tuned, because we are going to address some of those things in a future episode.
So as we always like to do at the end of every episode, let's get into a quick true and false to test the knowledge of our listeners. So Sheila, the first one's for you here. True or false? Most coughs in otherwise healthy people are caused by viruses, and antibiotics don't help them heal faster.
So true. Most upper respiratory tract infections are viral and self-limited, so antibiotics will not shorten the duration or severity of that cough. So Shaz, true or false? If a cough lasts more than a week, it means it's bacterial and needs antibiotics.
So that one is false. Like we talked about, a post-viral cough or a post-nasal drip can make the cough linger for 3, even up to 6 weeks as the airways and the inflammation in the airways recover. So duration alone does not decide whether you need antibiotics or not. All right, Sheila, true or false? Children under 6 can safely take over-the-counter cough suppressants for symptom relief.
So false. Health Canada does not recommend cough and cold medicines for kids under the age of 6 because they don't work and they may cause serious side effects. So Shaz, true or false? Supportive care like hydration, honey, humidifiers, and inhaler checks is an active form of treatment, not just doing nothing.
Absolutely true. So good supportive care actually does help with recovery. It can really help the body recover in the way that it needs and prevents an unnecessary use of antibiotics. So we always also like to end with a prescription for our listeners. So Sheila, can you take us away with the prescription?
Absolutely. So most coughs that we experience are viral. Skip the antibiotics unless your clinician says otherwise. And instead, hydrate, rest, and use humidifiers or steam. And try things like honey if you're over a year of age and warm fluids that can soothe your throat. And always remember, give your body some time and rest. And slow improvement over time does mean that there's healing happening.
That's so perfect. I think, when we think respiratory season, think comfort care, not quick prescriptions. And remember, of course, as we always say, if something feels off or if you're struggling to breathe, please reach out and see a doctor. That's what we're here for.
And Shaz, before we wrap, let's do our quick teaching corner for all our med student residents and colleagues who are listening in.
Perfect. Yes. So this is a new segment that we started recently, and we want to make sure that we're engaging with our healthcare worker audience as well. So here are our top 3 take-home points if you're caring for someone with a cough and cold this season.
So number 1, antibiotic stewardship starts with communication. Most acute coughs are viral, and evidence shows that antibiotics do not shorten the illness duration or severity. The key skill is expectation setting. This is so important, is explaining that the cough can last up to 3 to 6 weeks, outline supportive care and a safety net if anything changes or they need to, and tell them when they do need to come in. Clear conversations can reduce unnecessary prescribing and build trust.
I think that's an important piece there because we often almost feel like pressured to just give that prescription to a patient because we think that it's going to, improve their satisfaction and make them feel better. But instead, taking the time to have those conversations, like you said, is really what's going to build trust.
So much.
So number 2, identify red flags and exceptions early. So it's important to know who might actually need antibiotics or escalation of investigation. So if you suspect pneumonia, so either if they have, physical exam findings that are concerning, they've had a return of fever after not having a fever, like the double infection that you talked about. If they are tachypnic, so breathing quickly, they have an abnormal chest x-ray. That's the diagnosis of pneumonia. So that's an important reason to give antibiotics. Patients with chronic lung disease, and in particular, those with COPD exacerbations or asthma exacerbations with increased sputum production, a fever, or shortness of breath, these are patients that would warrant a course of antibiotics in addition to their puffers and steroids. And lastly, immunocompromised or frail older adults. These are patients where I have a low threshold for investigation, low threshold for reassessment, and low threshold to treat in those situations because of their other risk factors.
Yeah, these are all the patients, Chaz, that I put a reminder on my chart or I send a note to our nursing team who are awesome and they do a check-in call a couple days later to make sure that they're improving because if they're not, I want to see them again. And finally, our third teaching point for this week is supportive care is active care. So teaching self-management is clinical care. Hydration, humidifiers, honey for adults, nasal rinses for postnasal drip, and inhaler optimization for reactive airways. Doing nothing medically isn't passive care. It's actually guiding recovery very safely. And always document your advice. It is as vital as the diagnosis.
And when you document your return to see you or return to emerge instructions.
Yes, safety net advice. Yes, that's a term that you've taught me, Shaz. Safety net advice. I love it.
And that wraps up our episode for today. Please be sure to listen and share with others. You're definitely not alone if you're someone who is experiencing chronic coughs or, that cough that just doesn't go away, especially during cold or flu season.
And thank you for everyone for tuning into the Doc Talk. A reminder that the Doc Talk is for general information purposes only. This podcast is not intended to replace medical advice from your doctor. While we are doctors, we are not your doctor. Always speak to your own healthcare provider for questions related to your own personal health needs.
And of course, be sure to follow us on social media at the Doc Talk Pod and send us your questions and topic suggestions. We really love hearing from you.